Greetings. My name is Vikram Sikka. My friends call me the Barbarian, but in hospital records, I'm patient Vikram Sikka. Over a year ago, I had ligament trouble. ACL, MCL, meniscus, grade 3 levels. I could barely walk. I would crawl along, hang onto the walls, and push myself along. Been to a lot of places. I was told I would never walk again without surgery, and it was needed. But I didn't want to give up hope on myself. I believed that I could cure myself. I came to Noble Hospital. There's a wonderful team of physiotherapists out here. And they assured me that surgery wasn't needed, but that if I went through physiotherapy, I could walk again. It wasn't an easy journey. It's been nearly a year. But today, the man who was told he would never walk can walk confidently. Yes, I'm not in a condition where I can run a marathon as yet. I will do that one day. I want to climb some mountains and I'll do that one day. But today, my knees are much better. I don't have to crawl. When I came in, I was like on a wheelchair case, barely managing my life. Getting up in the morning was a nightmare. I would crawl out of bed. Going to the bathroom was a mess. Stepping out of the house was a horror story for me. Well, when I initially started physiotherapy, it was painful. Coming to the hospital was painful. Moving around was painful. And I started hating the physiotherapist. My God, what sort of torture are they making me go through? So initially, putting all the machines, all the exercises, IFT, laser, shockwave was not fun at all. And I would always go back home in pain. But then gradually, over a period of months, that pain started dissipating and getting lesser and lesser. My body also evolved. And I realized these exercises are there to strengthen me. And today, I'm much better. So what was pain has slowly dissipated. It's not a one-day event. It's going to be gradual. Initially, when I started out, we were a lot into machines. Again, laser, shockwave, IFT. But those are a little short-term benefits. When we switched over to physical exercise, and then, we removed the machine because, yes, over a period of time, the protocols need to be changed. When we revised the protocols about, say, 6-7 months ago, the change started happening because with physical exercise, the body started getting stronger. You see, a machine is a short-term benefit, which is fine. It works for a lot of people. In my case, that short-term benefit would get stopped very soon. But when I started strengthening my body, strengthening my legs, my calves, my thighs, my knees, that overall improvement started coming in. You see, what was a pain in the knee, now the rest of the body was supporting it. So I would say it's a gradual process. It doesn't happen overnight. But today when I look back on it, I would say around the midway mark, I started noticing a lot of difference. I would feel more confident in walking around, maybe traveling. Once I was not even happy stepping out of the house. Today, at least I can come to the hospital comfortably. And that's the miracle that I'm getting. I would first of all suggest look at your lifestyle and your needs. If you're a sports person, you're a cricketer, a footballer, and your revenue, your salary depends upon immediate gains, people might want to go for surgery. But if you're having a desk-bound job, you're not heavy duty into sports. Like in my case, I'm not a sportsman. Looking at me, you can't say I'm a Ronaldo or a Messi or a Neymar. So in my case, my career choices are different. I was okay with a gradual improvement in my knees. And that's exactly what's happened. So it's a case-by-case basis. I would tell you, if you're a sportsman and your salary depends upon quickly getting back on your feet, maybe you might want to look at surgery because those are quick gains. Again, a lot of therapy is needed afterward. But if you're not into heavy-duty sports or trekking or physical activities, try looking at physiotherapy. But remember, it's not like an antibiotic or a paracetamol, it works in one day. Physiotherapy is when you are letting your body heal and strengthen over a period of time. Well, exercise is tough. I sweat a lot. But at the end of the day, my knees are going to sing with happiness. Now, this is the reverse walk. It helps the muscles on the other side of the body. You saw the first one where I walked straight. Now walking backward. So, anyone does physiotherapy? Learn to walk backwards as well. And now this is the best exercise of all. You're testing your knee strength and doctor's strength. And today I'm giving the doctor a good workout. I bet he's never lifted this much of weight in any gym in his life. 7, 8, 9, 10. So don't look at instant results. Okay, doctor, why I'm not okay in 5 days or 10 days? Space yourself out. Give yourself a few months. See what's going on. Maybe change your exercise. But I believe physiotherapy, where you're strengthening your body, is what happens. End of the day, a stronger body, a healthier body. A big thank you to the physiotherapy department of Noble Hospital. Again, I'd like to thank Dr. Bhupender, Dr. Shreya, Jani Dixon. You all have been like angels for me. I came with a lot of pain, and today I go back with a lot less pain. I have a life to live. I can travel, I can move around. Something that I thought was impossible a year ago. So once again, thank you from the bottom of my heart. Thank you.